A very good morning to you, dear listener, and welcome to Perspectives, a current affairs discussion program on Agate Radio 95.5 Star FM, Makudi, Benue State. Today, our discussion is focused on World AIDS Day, which is observed annually on December 1 every year. Yesterday was the day as it was observed. Nigeria and Benue State joined the international community in observance of the day, which was first observed in 1988 by the World Raise Awareness and honor those who have died from the disease. According to the current statistics by UNAIDS and the WHO, estimates as at the end of 2023 indicates that 39.9 million people were living with HIV at the end of the year. And here in Nigeria, the National AIDS Control Agency, NACA, indicates that up to 1.4 million Nigerians are living with the disease in the country, and the need for AIDS awareness is essential as the infection is currently in how those living with the condition can be managed as well as avoid stigmatization. These are some of the issues we shall focus on today's edition of Perspectives. I've been joined here in the studio by three panelists who will drive the conversation. First is a medical doctor who is of the Department of Epidemiology and Community Medicine at the Benue State University Teaching Hospital, Makudi, Dr. Msonte Anza. Welcome to Perspectives, Dr. Anza.
Thank you very much, Nathaniel, for having me.
We also have with us a senior technical officer on key populations program with the APIN Public Health Initiatives in Benue State, Mrs. Lucia Toji. Welcome to Perspectives, Mrs. Toji.
Good morning, sir, and it's my pleasure.
Also joining us on this edition is a senior state counsel who is a desk officer on peace and reconciliation in the Ministry of Justice and acting director legal services, currently posted to Scholarship Board, Makudi. She is an advocate of a voice against the stigmatization of persons living with HIV and AIDS, Barrister Ahemen Boom. Welcome to Perspectives, Barrister.
Thank you, Nathaniel. I'm glad to be here.
My name is Nathaniel Nongu, welcoming you to this Monday edition of Perspectives. And if this is your first time tuning into the program, kindly be informed that Perspectives is audience participatory. It is usually broadcast every Monday, Wednesday, and Friday between 9 and 11 a.m. And at 10 o'clock, we allow you, the listener, to call in and also contribute on what we are discussing. You can participate on the program today later at 10 by calling in on the line 0814 335 9292, 0814 335 9292. The SMS line, which is also available, and WhatsApp that you can participate on the program is 0912 699 9404, 0912 699 9404. Log on to our website on www.agetradiotv.com, where the program is also streaming. You can also follow our social media pages to be a part of the conversation, and we're available on Radio Garden. You can also download the Agate Radio and TV app from Google Play Store, which will avail you the platforms of the newspaper online, our television online, as well as the radio. We're available on all these platforms to serve you. We'll take a short break, and once we are back, the discussion will start. Kindly stay with us. We'll be back shortly. Thank you for staying with us, and welcome back from that short break. I'd like to begin with you, Dr. Anza. What is the significance of World AIDS Day, and how has it evolved since 1988 as it's been observed across the world?
Thank you very much, Nathaniel, once more for inviting me. Good morning, listeners. The World AIDS Day is a day set aside by the World Health Organization to draw attention to the importance of this, I say just one of the days because there are other days that are focused on specific diseases. Setting aside that is to a specific disease entity in order to increase, intensify publicity about it, and this disease entity, how it is caused, how it can be prevented, where services related to its prevention, treatment, and care can be assessed. So since its inception, every year the World Organization comes up with a theme, which is to kind of provide a focus for that year's commemoration. For example, we'll soon be talking about the theme for the year 2024 and its significance. But with this strategy, every year, individuals and organizations that are working in this space, for instance, in the HIV/AIDS space, are able to put together activities, intensify awareness creation, and increase mobilization and increase advocacy towards the processes that are involved in, fighting and hopefully eliminating the disease entity from the face of the earth.
All right, Mrs. Toji, let me have area.
So thank you very much, Nathaniel. And I would like to say that the other discussant has actually said a lot about the significance of World AIDS Day. And you also have read the fact that it had, you also have noted that it started since 1988.
Yes.
And this year, this particular day is set aside as an important global reminder of the ongoing fight against HIV and AIDS. That's the World AIDS Day. And it has, for me, 4 or 5 broad significances. One, it's set aside to raise awareness about this particular disease and inform people about how what the disease is, how it can be transmitted, how we can prevent, and educate people about HIV and reduce about stigma reduction. And the second is about honoring those affected, the memory of those that are infected and also affected by HIV and AIDS, and then encouraging action for different stakeholders in the response, the government, the communities, and even those affected, about raising awareness and then encouraging people to take action, and then promoting the support of those communities that are affected. And since the inception in 1998, the World AIDS Day has promoted global awareness on this epidemic. And it has also, in the 90s, it brought about early awareness and advocacy around the HIV epidemic. And around the 2000s, from year 2000, it really focused, the themes around World AIDS Day focused around expanding access to the treatment or management of the disease. And around 2010-ish, it spoke about strengthening prevention and treatment, access to prevention and treatment services, what people can do. And but generally, it's about raising awareness, raising support, and taking action.
Okay. Okay, Barrister Boom, let me also have your thoughts. You are an advocate working along Ben Saka here in Benue as a voice to champion the fight against HIV and AIDS pandemic. What do you make of the observance of the World AIDS Day this year?
Thank you. World AIDS Day is observed annually on the first day of December every year. It raises awareness about HIV/AIDS and demonstrates international solidarity in the fair partners to spread awareness about the status of the pandemic and encourage the progress in HIV/AIDS prevention, treatment, and care around the world. The significance of World AIDS Day can be seen in several aspects. Firstly, it raises awareness about HIV and AIDS, helping to reduce stigma and discrimination against people living with HIV, Secondly, it promotes education on AIDS prevention and control, encouraging individuals to take action to protect themselves and others, other people around them. Thirdly, it mourns those who have died from the pandemic. The people that have died, we remember them. The people that have lost their lives because of the pandemic, HIV and AIDS, honoring their memories and reaffirming the commitment to fighting the pandemic.
Okay. Now, Barrister, I beg your pardon, Dr. Anzah, I am with you now. And let's look at the theme for the day this year, which talks about take the right path, sustain HIV ending into 2030. The global theme generally is take the right path, my health, my right. But Nigeria and have narrowed its own thing to in Nigeria by 2030. To what extent are we on the path of ending HIV and AIDS in Nigeria and its level of prevalence in children as Nigeria is focusing its response on how the pandemic is affecting children?
Okay, thank you very much. If you look at the global theme for this year's World AIDS Day,
yes,
it says taking the right path. Right?
Yes.
The health is not just a point, a thing of maybe medical sciences. Health has a social component, and health is also is viewed from the point of view of a right, a fundamental, right, and it's important to adopt that approach because in a number of places there are factors that can hinder access to HIV and AIDS prevention, treatment, and curative services. Some of which I believe that my co-discussant here will go into details maybe shortly. Things that have to do with gender-based violence, things that have to do with discrimination, stigmatization, which can come from places of work and all of that. So a lot of things that may not be directly related to the biology or the pathogenesis of the AIDS, the HIV/AIDS itself, but are social factors that enable or hinder efforts that are being made towards the elimination or containment of this pandemic. So taking the right approach emphasizes focus on some of these areas and how efforts can be made, intensified, and structures can be put in place to drive the fight in the direction of dismantling these barriers to access to care, And then you talked about in Nigeria at the moment we are looking at preventing HIV spread in children because if you look at the statistics, between those aged between 15 and 24, when you start to look at the breakdown of the prevalence of the disease and the epidemiology of it, you find that people aged between 15 and 24 are leading in terms of the numbers of those who are having HIV infections, the prevalence and then the incidence. And one of the commonest causes of HIV infection in this population, this age group, is mother-to-child transmission. So efforts are being made. If you look at the packages that are now offered in this fight against HIV, you are going to see a lot of talk about prevention of mother-to-child transmission, and there are now programs that are focusing on adolescents, programs that are focusing, so there are programs that are being designed to focus on these specific age groups with the hope that when you cut the chain of transmission, the mother-to-child transmission, when you cut that chain from that point, we are going to really be able to significantly pin down and restrain the transmission.
This year, take the right path, my health, my right, and Nigeria narrowing its particular one to sustain HIV response, stop HIV among children and end AIDS in Nigeria by 2030. To what extent are we on the right path in Nigeria and the prevalence in children?
All right. Generally, and globally, we've set targets for ending AIDS by 2030, and those are succinctly captured under the UN AIDS 95-95-95 goals, which says that 95 persons who had not known their HIV status should know their HIV status and be placed on HIV. And those that 95% of those that have been identified and placed on HIV on ART,
that's the antiretroviral
drugs.
Okay.
Those 95% of those that are placed on antiretrovirals should be also managed to attain viral suppression, because it is in attaining viral suppression that HIV would not be transmitted sexually to another person. And if you look at the statistics generally that we have now, we have made significant progress in, and we are at different levels in those 395s. But we discovered that generally we are not doing well with certain category of persons. And for Nigeria, we have discovered that among the age group of 1 to 4, 5 to 9, and 10 to 14, there's a treatment gap. What do I mean by treatment gap? It means that we still, based on the estimates that we still have not been able to sufficiently find the new infections among those group of persons. So these teams just highlights and encourages our governments and general stakeholders to work towards ensuring that we currently sustain what we are doing well on the response, to ensure that we do not relapse. And then for those areas where we are not doing well, we try as much as possible to catch up to ensure that we are able to attain the global goals by 2025 initially, and then 2030, just as stated by the country. So we're actually on track, but we need to sustain and then scale up and close those gaps that we really have identified. That's about finding cases among children generally. And we expect that the government takes issues of service access to persons living with HIV as a matter of rights, knowing fully that all individuals have a right to health services that should be upheld. So we are on track, but we also need to close the gaps in the areas where we have identified.
And of course, the rest among children. To what extent an advocate, not just a legal practitioner, one who is an advocate in the cause of those living with HIV and AIDS?
Thank you. Before now, where I think Ben Saka has placed, they have a law that protects people living with HIV and AIDS. Even the ground norm of this country, that's the 1999 Constitution, protects every individual, irrespective of whether you're living with HIV and AIDS or not. The fundamental human rights enshrined in the Constitution protects people. Know their right. If you don't know your right, how do you fight for it? But if you know your right, you know that these are the rights are trampled upon. You know where to go to assess justice.
Okay. So at the moment, anyway, we'll come later on to stigmatization. But yes, in essence, are people saying we choose to focus is thing to take the right path, my head, my right? The right path is rights of persons living with HIV and AIDS being violated?
I will not say no. Yes. People living with HIV's rights have been affected because there are certain companies, certain organizations that do testings on people without their permission to know if you're HIV positive or not. And if you are seen to be HIV positive, you cannot get that job because of your, because that could be stigmatization. Because you are HIV positive, you cannot work in a particular place or you cannot own a particular job because you are HIV. So I will not say that people living with HIV and AIDS are not stigmatized. They are stigmatized. And that is why we want to create this awareness to make people know that this is not a death sentence. People can live their normal lives even with HIV and AIDS. People can walk anywhere they want to walk even with HIV and AIDS. So people should not be stopped from working or having a source of income because they are HIV positive.
All right, Dr. Anzah, what are the risk factors for HIV and AIDS? And give us, generally we are focused on the day, give us an understanding properly into what HIV and AIDS condition is about and the risk factors associated with it.
Thank you very much. HIV is an acronym that stands for Human Immunodeficiency Virus. And then AIDS, AIDS, is Acquired Immunodeficiency Syndrome. HIV is the virus or the organism that causes a disease called AIDS. So one comes before the other. Now, the HIV, when it infects someone, the person does not yet have AIDS, even though they have the HIV infection. Now, it is as the pathogenesis of the virus continues in the person's body, what it does usually is that it aims for the immune system of the individual, infects the immune system, tries to use the mechanism by which the body produces its own immune system it takes over the factory that the body uses to manufacture its defense system and uses that factory to reproduce itself. So instead of the body producing the soldiers, I would like to call them, that will defend the body against both the virus and other forms of infections, this factory begins to churn out copies and copies and copies of this virus. So the immune system is knocked out, stop the HIV virus, but also unable to stop any other infection, any other disease entity at all. Even those that were in the body but were being held down by the immune system suddenly become free. So the individual is open to all manner of infections, most which we call opportunistic infections. Opportunistic because they were not able to do anything on their own until such an opportunity as this becomes available. And then when some of those, when the person gets to this stage where they begin to manifest these symptoms of immunodeficiency, we say, okay, this individual now has AIDS. AIDS is the disease arm. It's a spectrum. There is the infection at the left end of the spectrum. Then there is AIDS on the right end of the spectrum. Now, what are the
risk
factors for transmission of HIV? HIV infection occurs through a number of ways. We'll talk about vertical transmission, which is the transmission that passes from the mother to the child. This can happen when the mother is pregnant with the baby in the womb. It can happen during labor and delivery, that process of labor and delivery. It can also happen after delivery during breastfeeding, So this is one of the ways through which HIV can be transmitted, the vertical transmission. Then there is the horizontal transmission that moves from one person to another, at the horizontal level. And this can happen through transfusion of unscreened blood products. If the blood is unscreened from someone who is infected with the virus and is transfused to somebody who doesn't have it, they can come down with the virus. Unprotected sex with somebody who is infected. This can be heterosexual sexual intercourse, that's between different gender. It can also be between homosexual, sexual intercourse. It can be through vagina. It can also be through anal. Then it can also be transmitted through sharing of sharp objects, And then for healthcare professionals, things like needle prick injuries and so on can also transmit this virus.
Okay, Mrs. Toji,
Yes.
are there some of these risk factors you would like to add?
No, he actually has said a lot, and he gave us the comprehensive modes of transmission for HIV, the vertical and then the horizontal. They are the main ways, and they were adequately qualified through unprotected sexual intercourse with someone who is infected. And of course, he also spoke about the fact that he has to come through transmission or transfusion of unscreened infected blood or blood products, and through sharing of needles and sharp objects, and then from the mother to the child, either during breastfeeding, just to re-echo. And of course, we also need to know that sexual intercourse is not just by heterosexual sexual intercourse. It is also sex between a man and a man, and a woman and a woman can also lead to transmission of HIV, most especially when there's exchange of fluids, and then there are windows and doors that the HIV infection can pass through. So, yeah.
Okay,
Yeah.
When you mentioned mother-to-child transmission in particular, and given that Nigeria is looking at its ways of sustaining HIV response, stopping HIV among children of HIV and AIDS.
Yeah, there's a lot can be done, but of course, at that point, most of what can be done to prevent mother-to-child transmission is around the mother herself. But of course, I wouldn't want to leave the father out also, because child conception happens when two people are involved.
Yes.
Child transmission is by ensuring that women who are pregnant access antenatal care and on time, because and the antenatal care we are talking about would mainly be at health facilities, because at health facilities there's that mandatory HIV test that is conducted, and HIV, and at that point you get to find out the child. But we find out that a lot of women, there are some women, pockets of women that are still not accessing HIV, accessing antenatal care services at health facilities. We still have people who are going to traditional birth attendants to access those ANC, those delivery services, so to say. And one thing that our organization is doing is to work with traditional birth attendants to make them understand that as women come to them to deliver, they also need to encourage those women to access HIV testing services. And we've gone from just having to talk to them to pair HIV testers to those traditional birth attendants to ensure that as those people come, our testers are alerted from the field, and they work with the women to link them to ART services to reduce the viral load, so that vertical transmission, the chances for the vertical transmission is reduced to the barest minimum. So that's
okay. Barrister Kwon, let me come to you now. What are some of the challenges faced by people living with HIV and AIDS that in your advocacy for them you have encountered, and how can these challenges be addressed?
Okay, thank you very much. Stigma and discrimination significantly impacts people living with HIV and AIDS. affecting their physical and mental well-being, social relationships, and access to health care. Social isolation. People living with HIV and AIDS fear rejection, judgment. People pointing fingers at them that even that one, even her, she has HIV and AIDS. You lose your self-confidence. You lose your self your self-integrity, your self-prestige. You cannot carry yourself high. You cannot move about with your head held up high because you are afraid that people will stigmatize you, people will point fingers at you, and it makes you lose all that. They fear going to gatherings, they lose their social life because of this discrimination. Anxiety and stress. Constant fear of disclosure, discrimination, or violence causes significant emotional distress. Low self-esteem. Internalized stigma can lead to feelings of shame, guilt, and worthlessness. And sometimes it makes them have the fear of going to access health care. So they are afraid going to open up even to their medical practitioners that I am HIV positive and I need to access health care. This is what makes them stay back at home and lose their lives in the end. Delayed or avoided testing. Most people are afraid to go test because they are afraid of the stigma, discrimination, what people will say about them. Jobless and joblessness, unemployment in their workplaces, just like I earlier said, that disclosure of HIV status can lead to joblessness. People can lose their jobs because there are certain organizations, certain companies that when they know that you are HIV positive, you could lose your job. Stigma and discrimination can result to reduced income, poverty, and limited access to education and job training. A violation of human rights as well. Stigma and discrimination can lead to violation of human rights, including the right to health care, which I already mentioned, dignity, and all that. Addressing stigma and discrimination is crucial to ensuring that people living with HIV and AIDS can access health care, the health care that they need, the support services, with dignity and respect. When they go to the healthcare facilities, they should be treated with respect, dignity. People should not discriminate on them because the fight will be lost if people who attend to them discriminate on them.
All
So
right.
just to also add that in line with what she had said, and the theme for this year's World AIDS Day, we talked about taking the right pathway. Stigma can actually also increase people's exposure to violation of rights, and it can, to a very large extent, also lead people to going into hiding and not accessing health care services that are even available for them. And if going into hiding would make us to make it difficult for us to be able to curb the spread against HIV, knowing fully well that as people go into hiding, when they do not access those services, they leave other people that are around them at risk of getting infected also. So as much as possible, when we are able to address stigma, it would go a long way in helping us to also achieve the global targets that we have set for ourselves.
All right, dear listener, if you are just tuning in, you've been listening to Perspectives on Agate Radio 95.5 Star FM Makurdi. Our discussion is focused on World AIDS Day, which was observed yesterday, and today we have provided a platform to discuss it, to raise awareness about the condition and ways of preventing it. Leading the discussion here in the studio, I have with me a medical doctor who is of the Department of Epidemiology and Community Medicine at the Benue State University Teaching Hospital, Makurdi, Dr. Msonte Anzah, and a senior technical officer on key working in the area of HIV and AIDS prevention, living with HIV and AIDS, a senior state counsel with the Ministry of Justice and Public Order in Benue State, Barrister Aheme Boone is also with us on the program. And at 10 o'clock, we avail you the line. The line will be open for you to call in. You can take the number now to participate at 10 o'clock. The number is 0814-335-9292. 0814-335-9292. In the meantime, the SMS line, which is also available on WhatsApp, is already activated. You can send an SMS or a chat on WhatsApp to 0912-699-9404. 0912-699-9404. Remember to include your full name and where you're sending your message from. Log on to our website on www.agetradiotv.com to access our content and, of course, listen to the live stream of the program if you are not able to tune in. You can also log on to our website. You can also follow us on our social media pages. We're available on Radio Garden, as well as you can download the Agate Radio and TV app from Google Play Store, which we also avail you the platforms of our newspaper, the television online, as well as the radio, that you can listen to us any part of the world. Dr. Anzah, let's stay a little more on this issue of mother-to-child transmission, because this is also a hub of it. Is there any possibility that a woman living with HIV and AIDS can give birth to a child without transmitting the condition to a child?
Yes, and that is the goal of prevention of mother-to-child transmission. That women who are HIV positive give birth to children, to babies who are HIV negative. And like my co-discussant was saying earlier, there are a number of pillars that this prevention of mother-to-child transmission focuses on. First of all, the women who are giving birth to these children are human beings. They are members of the society. They are just a segment of the population, but they are part of the whole. If we generally work towards reducing HIV prevalence, HIV incidence in the general population, the chances that women who also make a part of the general population will have HIV/AIDS in the first place will be low. That's the first point. Because if women of reproductive age, or if women generally if there's low prevalence and incidence of HIV/AIDS among this population, that means that women who will be going into their pregnancies HIV positive will be minimal. That already is a reduction in the chances of transmission. Then secondly, it's to to make sure that women who are intending to carry babies, who intend to be pregnant, when they become pregnant, register early for antenatal care. During that, there are a number of routine screenings that are done, and those who are positive will be detected, and they'll be enrolled into antiretroviral therapy. And by the time they are, the pregnancy is in course, they would have achieved viral suppression. So if they are achieved viral suppression, they will not be able to transmit that virus to their babies during, the pregnancy. And it is also to ensure that women who are HIV positive have access to, family planning, contraceptive services, so that they take in only when they want to take in what we call planned pregnancy. Because if you are planning a pregnancy, you pay more attention to your health and other things. But if they don't have access to reproductive care, pregnancy that is unplanned is also stands a higher chance compared to planned pregnancy of transmitting the virus. And then when it comes to delivery, the process of labor, there's a way that precautions to take and all of that to ensure that this woman in the course of delivery does not transmit this virus to the child. But within the last 4 weeks of the pregnancy, if the viral load is if the woman is virally suppressed, chances are very slim of transmitting the virus to the baby. And then after delivery, there are medications, what we call prophylaxis,
Yes.
because they are for protection, for prevention, that the baby is placed on to prevent the child from contracting the virus from the mother during breastfeeding. So there are a number of steps that are put in place, and if our listeners follow these steps, even women who are HIV positive, will enhance their chances of delivering HIV negative babies, and that is one critical element, one critical step in containing the spread of this virus, especially through the vertical route of transmission.
Okay, Mrs. Toje, you are in the field, so let's move away from mother to child transmission, which we have talked exhaustively about now. The extent of prevalence. What is the prevalence rate of HIV and AIDS in Benue State?
All right. Currently, based on Nigeria's Benue State, Nigeria's HIV prevalence is 219 actually. Nigeria's HIV prevalence is 1.4, while the Benue State HIV prevalence was 4.9% as at that survey. But of course, in between, there are other subpopulations within that spectrum. Within the 4.9, there are different subpopulations that have different HIV prevalence among them. And among the key populations, generally key populations who are considered to be most at risk, that's the female sex workers, persons who inject drugs, transgendered persons, and high-risk men. Their HIV prevalence is significantly high. And among female sex workers, the HIV prevalence in Benue is about 19.7% as at the time that survey was conducted. So yes, Benue is actually reduced significantly from the previous survey that was done. But there are also some other populations that we need to pay attention to if we really would win the fight against HIV. And those populations are the persons we consider as key populations. Yeah.
Yes, let's talk more about the key populations and the extent of awareness we can engage with them, especially that you are the senior technical officer on key populations program of APIN Public Health Initiative.
Yeah. Sorry?
No, I wanted us to dwell more on those key populations and the level of enlightenment they have towards HIV response and prevention in general.
Okay, so key populations, we, as APIN Public Health Initiatives, we are working with the government to ensure that we are able to identify these populations and ensure that we provide access to services, which is like a human rights from a human rights perspective, knowing fully well that in spite of the behaviors that they adopt, they are still individuals that have rights to health that should be respected by the should I say, by the response and by the government. So we are working with these groups to ensure that we increase access to awareness, HIV prevention services and information. And we also, among them, have engaged some members of their groups to ensure that they are able to identify them and then provide HIV testing services to them and then link them to antiretroviral therapy to ensure that they are able to attain viral community members. So we are working with them to identify, provide HIV prevention information and services, link them to testing, and then link them to ART, and then work with them to ensure that we also are able to contain the virus so that Benue will be able to also reach the global goal of ending AIDS by 2030.
Okay, but at the moment, based on what your organization is working in the field, you can tell us on good authority that Benue have maybe a low profile on HIV prevalence. Is that what you are telling us?
Yeah, compared to other states, and when it comes to issues of HIV infection and prevention, we really are not in competition with other states. The only state we have to compete with is ourselves to ensure that we are able to contain the virus. So yes, we are happy with the fact that the state is making progress. We were at some point, and at 2019 we dropped from, I think about, let me not quote statistics, I really do not remember again, but we had dropped from the number we were to 4.9 as a state, which shows, I think, 5.2 to 4.9 from the previous survey that was conducted. So we actually are in competition with ourselves to ensure that those gaps that are identified as a state, we are able to address those gaps to ensure that we are able to make progress and then ensure that the virus is addressed within our communities, and we are sure that we are having children that are born without HIV, and then within the general population also we are sure that there is the incidences of HIV is also curbed. Yeah.
All right, Barrister Akpom, you work as an advocate, you work along with BENSACA. In fact, your recommendation to feature on this program came from the Executive Secretary of BENSACA. Give us an understanding into what you are aware of the prevalence and the community engagement in terms of sensitization that people have, their awareness about HIV and AIDS in Benue State.
Okay. On a day like this, we also sensitize people. We tell them about this. In fact, things are given, condoms are given free of charge. What again? APIN. Help me with those things people give. There are so many things that are given to people to prevent transmission of HIV and AIDS, And then even with the key among the key population, there are certain, because of their lifestyle, there are fluids. Several things that are given, especially today.
Lubricants.
Those are also for preventive measures, prevent people from contacting HIV and AIDS, condoms, awareness, you name it, sensitizations to make people aware of this virus and ways in which they can prevent further spread of this virus. Just like the doctor earlier said that for mother-to-child prevention, prophylaxis, infant prophylaxis are given to children whose mothers are already infected with this HIV and AIDS to prevent further transmission of this HIV and AIDS.
All right. Dear listener, if you are just tuning in, once again, this is the Perspectives on iGate Radio. We are discussing World AIDS Day. We'll start taking your calls any moment from now, but that will be after this breather. Kindly stay with us. Welcome back, and thank you very much for staying with us. The number to participate on the program, once again, is 0814-335-9292. 0814-335-9292. Once you connect with us, we'd like to know your full name and where you are calling from. kindly move away from your radio set once you're connected with us, or turn down its volume. Send us an SMS to 4. That's the line through which you can send an SMS. The line is also available on WhatsApp. Log onto our website on www.ageradiotv.com to listen to us and access other content of Agate Radio as well. Good morning. Hello, good morning. Okay, you are on, but your voice is not coming through, so you may try to call back. The line again is 0814-335-9292. Good morning. Hello. Good morning, and thank you for joining us.
Good morning, Nat.
Thank you for joining us.
It's the voice of Mark Anwangbe, the father from Seaga, Gweloko Goma.
All right, go ahead.
Please, I may like to appreciate the enlightenment through for us by the studio. They have all spoken well. For me, I may put it in a very snappy way. I want to warn the couple and the partners to base on their partners and concentrate on their partners to avoid contacting this transmitted disease like HIV. And if it is necessary for you to fail to concentrate or focus on your partner, please make sure that you are going out with this behavior or sexual behavior with protective measures like condoms. I think it is a very easy way to have protected. And I want to advise the government to engage the community by awareness, creation of awareness, because then there was an awareness going down to the rural community, but now many people can't see that HIV is not a deadly disease or a dangerous disease like others. Many used to say that HIV is not a disease furthermore, but it's not true. So if the awareness is being created in the rural communities, I think that will throw more light to the people. Thank you for the opportunity.
Thank you, Mark. Thank you for calling in. But we hope that this has also provided an awareness to you. Anyway, you admitted, so we appreciate you for calling in.
So I think it's emphasizing being faithful to a faithful, uninfected partner.
Okay.
Yes.
Because
when we come to strategies for prevention, we'll talk more on that. Good morning.
Hello?
Good morning.
Good morning.
Welcome to Perspectives.
Yes, this is Kwaza Vincent calling from North Bank, Macaulay.
Okay, good to have you join us, Kwaza Vincent.
Yes, I greet the guests this evening. Yes,
Thank you.
I want to ask a question. Because this HIV/AIDS transmission. People say that when you are diagnosed with this HIV/AIDS, and that patient is consistently taking this or her medication for a period of time, this HIV/AIDS maybe it cure the HIV/AIDS, it cannot be transmitted to another person again. So is it true like that? That it cannot be transmitted when you take the drug consistently?
Okay. Could that be all from you, Kwaza?
Yes.
Thank you. We'll respond to you. Thanks for calling in. Okay, Kwaza wants to know if one is faithful to the antiretroviral drugs, whether he or she can still transmit the disease. Good morning.
Hello.
Morning.
Good morning, sir.
Thank you for joining us on Perspectives.
This is Joel calling from Numbank.
The name is who?
Joel.
Joel who?
Yes, it's Joel Godwin. My question is it possible for someone's blood type to be a barrier against contacting HIV?
Okay.
Yes, because I've heard people say that if your blood is strong, it's very difficult for you to contact, even though you meet with somebody that is positive.
Okay. Thank you, Joel. Blood group. So many things we are going to we'll answer you. Of course, we're here for you. Good morning.
Good morning, Mr. Nathaniel.
Welcome to Perspectives.
Daniel Turner from your view on the land.
Okay, Daniel, go ahead.
Long time.
Yeah, good to have you here.
I want to appreciate you so much and discuss the studios. But I need to have some few questions to ask.
Yes,
One
go ahead
is,
with them.
There's one question is, I don't know, the barrister there just mentioned of sometimes they will go out, they will be testing people, giving them condoms and whatever. But in my community, there was a time that those people came, they were testing us free. So when they say that, when our youth request that, what about the condom? They claim that they did not give them condom. So I want, and secondly, I would like the federal government. You see, we're in the global world now. I don't know whether those scientists, those scientists, they did not research to get even a vaccine to do against this HIV, because even this COVID-19 that just came, that they look for a way to say this is a vaccine. So HIV is more than how many years now? So they want to tell us that there's no research, and so that they will research, and there's no even vaccine. No country has ever seen a vaccine to do this thing.
Okay.
This please. If my question are answered, I'll be very happy.
Okay.
Thank you, Daniel.
Thank you, Daniel. Thank you very much for calling in. Anyway, we have scientists. The medical doctor is a scientist by experience too. So he will tell us whether they have achieved the feat of getting a vaccine. Good morning.
Hello, good morning, Mr. Nat and the guest in the studio.
Thank you for joining us.
This is the voice of Ado Bartolome Tefa from Bachoho in Gwe West Local Government.
Very well. Go ahead.
Yes, I must thank our mommy and other guests in the studio for the wonderful explanation they have given to us. But I have a question before I continue, sir.
Go on.
Yes. What is how the percentage condom can one cannot get HIV using condom? How effective is the use of condom? And what is the right approach for one to take in order to avoid the spread of this HIV and AIDS we are talking about? And again, I want to also appeal that I've been hearing of female condom being given to people by NACA. I've never one day seen it. And how are they sensitizing people regarding this HIV and AIDS and how to prevent it?
Tefa,
however, on the whole,
Tefa,
I want to...
Hello, Tefa.
Yes.
Are you a female? Why are you interested in seeing a female?
No.
Okay,
It's
Tefa.
okay. Yes, on the whole round, I want to advise that, this issue of stigmatization has really cost us a lot in the society. And I want to appeal that the government should stiffen the law governing people living with HIV and AIDS. If you stigmatize, let the law go with you.
All right.
And I believe this will curtail this issue, because most at times, as the guests have said, pointing hands at people that this one man didn't get HIV, this one has gotten it is not doing us well. So we are appealing that people should cultivate the habit of voluntarily going for HIV test,
right,
so that you know your status.
Thank you.
It will help us a lot. Thank you.
Thank you, Tefa. Thank you very much for calling in. Please, once you call, try to be brief to enable others also have the opportunity to participate on the program. Good morning.
Good morning,
Welcome.
Nathaniel.
Welcome to the program.
Thank you very much. This is the voice of Solomon Peke from Uday.
Okay, how is your day this morning, Solomon?
No, we are very cool.
Good. Go ahead.
I'm sorry to say this. Somebody said I should extend his condolence to you that you lost Unongu. I said it's not Unongu.
Unongu is our father, so I accept the condolence. He is the father. He's the father of all of us in Benue. So thank you all the same. Go ahead now, Solomon.
Okay, Nathaniel Nongu, thank you very much this morning. Living with people. Under people living with HIV and AIDS, it creates shame and fear. I want the federal government of Nigeria to address this issue of stigma on people living with people living with disability. PWD. The same law should be addressed on people living with HIV.
Okay.
You go to other countries now, they give them jackets that I'm a HIV victim. They are proud of that. But if you come to Nigeria, people don't want to identify to people that they have HIV because of the stigma. So it's worrisome. It's unacceptable.
All right.
Thank you very much.
Thank you, Solomon. We appreciate you for calling in. Let's stop the stigma. Solomon says so. Government should also encourage platforms that we mitigate our stigma.
Hello, Nathaniel.
Good morning.
This is Magdalene Yehumba from Yakia.
Oh, good to have you join us, Magdalene.
Thank you. About HIV, I have a lot to say, but because of time.
Yes, say
People
only the
make it
brief,
look
because
as
not the lot. The
people
lot will
make
take the whole time.
people make it look as if people living with HIV does not have a right to love and be loved. Like once you are HIV, you need to be thrown into hell, fire, just burn the person to ashes. And this is the reason why most people are being infected with this virus, because the stigmatization has become so much such that once a person is diagnosed of HIV, the person feels as if that is the end of life for him or her. And women are giving birth to children now. The children are being safe, free from HIV. But the issue of stigmatization is not being properly addressed. Somebody can live with a woman can live with a man for as long as they can. As long as the woman is taking her drugs, or as long as the man is taking his drugs. But the pain, the shame of opening up to tell a partner that I am HIV positive is a problem, because once you open your mouth to say that, oh, you are a devil. So a lot needs to be done about this stigmatization issue. It shouldn't be only talking. There should be an action about this. That will reduce the number of persons contacting the virus, because you open up, there are ways you can help yourself to live together, not hiding from your partner. Thank you very much.
Magdalene, thank you for calling in. We appreciate you. If you have contracted HIV and AIDS, don't hide it from your partner. Open up so that there will be a window for both of you to access health care. That is what Magdalene is saying. Good morning.
Good morning, Nathaniel.
Thank you for joining us. You sound very distant from your phone. Could you come closer so we hear you better?
Yes, can you hear me now?
Very well.
Yes, my name is Jonah Benjamin. I'm calling from Nakagwewe.
All right, good to have you join us on Perspectives, Jonah. How is Naka this morning?
Yes, we thank God it's very fine.
Good.
Yes, I thank the guests in the studio. Mine is just a question.
Yes.
Can you hear me? Listen, through mosquito.
Okay, thank you, mosquito bite. If it bites.
Good morning, sir. Nathaniel.
Thank you for joining us.
My name is Vincent. Okay, I just please beg them not to take revenge and say, okay, somebody infected me with this HIV, I'm not going to die alone, I'm going to distribute it. Since it is not written on anybody's forehead, why will not identify me having AIDS or not? So they should please have the fear of God and do not take revenge by distributing it to other people. Thank you very much, sir.
All right, thank you, Vincent. Thank you for calling in. Okay, these are Benue people and Nigerians speaking their mind, seeking the information, what they need to know about HIV and AIDS, and you can also do so. Good morning.
Good morning, how are you?
I'm fine, thank you. Could you speak up so we hear you better?
Yes.
Okay.
I'm very appreciative you people because you have bring a very interesting topic. Hello, sir.
Yes, Tefa, we are listening to you.
So, what I'm saying is that at times, couples, one among them have the HIV, but at times they have children. For a new why when they are going to test. So why testing? There's one person is affected. Why?
Okay, Tefa, could that be all from you? Okay, Tefa has made his submission and is gone off the line already. But that's okay. We have heard your concern and I hope we'll respond to it. Good morning.
Good morning, Mr. Nathaniel Nungo.
Thank you for joining us.
Good morning to your guests in the studio.
Thank you.
I am Engineer Sunday Akpa, calling from North Bank, Makodi.
All right.
I'm going to be very brief. Although I didn't start from the beginning, I don't know whether they have answered this question. My question is like this. What is the origin of this HIV/AIDS? How did it come about? How did it even enter the world? Okay. Where did it come from? That's all. That's all from me.
Okay. Sunday Akpa, thank you very much.
Thank you very much.
We appreciate it. Okay, we should go back to the roots of HIV and AIDS. Sunday Akpa wants to know the origin. So many interesting questions. You get to hear our perspectives. Good morning.
Hello, good morning, my brother.
Thank you for joining us.
Yes, I'm Peter Tiller. I'm calling from outside IBB Square, outside the fence.
Okay,
Yes,
Peter, go on.
yes. I was inside. I came outside now.
Okay,
I'm
Peter, we do
outside
not have all the time. Just go ahead. You have heard
Exactly.
your location.
I want to sincerely appreciate money. And my elder brother, Engineer Sunday Agba, said something very important and it's very significant, that question. But a priest told me that it was disobedient because of the issue of morality. That issue of people discriminating people that are linked to this virus, it is not good. We should show them love and affection. Because many of the people that are infected with this virus, it's not their fault. Many of them came out with it from their mother's womb. And it's a reality and it's true. I know many that came out from the womb with from the wound of their mother with this virus. So is it their fault? It's not their fault. And none of us is safe because in one way or another, we go to the salon, we make use of razor blade and other things. We should be very conscious of the fact that when we are using all these sharp objects, must be sterilized. And then we should abstinence. The youth, the coming generation, if you are negative, abstain from sex. When you get married, then you enjoy the phase of sex. And constant testing so that we know what is there.
Okay.
And we should avail ourselves to be sincere. Once you have this virus, don't go about to give people. Because when you do it, God will be very, very angry with you. Just go to the hospital and let people be aware of your ailments. It's nothing bad. And don't be afraid and be ashamed of going to the hospital to get those antiviral drugs.
All right.
There are people that are not living with it, but they are even dead and gone.
Peter,
you can still live as much longer.
Thank
so
you.
You should not be afraid. It's
Thank
not your fault.
Thank you, Peter. Thank you very much for calling in. We appreciate you. I'm sorry we'll have to let you go because you have taken time and we need to also allow other persons the opportunity. Good morning.
Hello.
Good morning.
Morning. This is Peke Solomon back.
Okay,
Very
Peke,
brief.
just
Very brief.
10 seconds. We allow people to call on this program only once now. So
Thank you very much, Nathaniel. The issue of this, the origin of it, me, I want to tell my other caller, this and that, but that is from the punishment of God.
Okay, thank you. I don't think scientifically that may be correct to say so, but we appreciate you. You are entitled to your opinion. Let's hear the expert opinion. Good morning.
Good morning, sir.
Thank you for joining us.
Yeah, this is Enoch calling from Gwe East.
The name is who?
Enoch Ongu.
Enoch Ongu from Gwe East. Which part of Gwe East are you calling us from?
Ahumbe.
Ahumbe. Good. Go ahead, Enoch.
Yeah, I want to just say an advice that there is a time I have a dear friend who was positive to me. Me that I was not positive. So I just want to tell my other listeners that if somebody has HIV or even with person, there is a way you can prevent yourself by going to the hospital and testing you that you are not positive, and there is something will be done about it. So we should not be running away from these people. That is what he was already on the head care. She was taking drugs, but she did not open it to me by the time of the relationship.
Okay. Thank you. Thank you very much. Stay safe, Enoch. We appreciate you for calling in and sharing that experience with us. Good morning. Okay, you are on, but your voice is not coming through. Quite unfortunate. The line is still available if you are able to connect back. Okay.
Taking the Moses Kuhwe, I'm calling from my sister Makodi.
Taking the Moses Kuhwe?
Yes, sir.
Okay.
Yeah, mine is a question. I want to know the symptoms of HIV in children.
Okay. Could that be all, Taking?
Yes, sir.
All right. Thank you. We appreciate you for calling in. Okay, let's stay on temporary with a course now and address these concerns we have. Beginning with Kwaza Vincent, who wants to know if one is consistently taking the antiretroviral drugs, will the person still transmit HIV and AIDS? Dr. Anza, respond to this briefly.
Thank you very much. I think another thing that Mr. Kwaza wanted to know was whether if somebody is on the antiretroviral medications for long, they can actually achieve cure. I think that resonated clearly in what the question he wanted to he asked.
Okay.
Well, we have a slogan in this campaign that is called "You is equal to you." That means undetectable is equal to untransmissible. Means if somebody is on antiretroviral medications for a long time, who is responding to them and achieves viral suppression, whose viral load is undetected stands a very low chance of transmitting the virus to anybody else, So that is part of what the campaign aims to achieve, part of what antiretroviral therapy aims to achieve viral suppression and therefore reduce to the barest minimum the chances of somebody who has HIV transmitting the virus to those who don't have it. Then there's a misconception out there about people who, after maybe their viral load has been undetected for a long time, cure for this virus. There's no cure for HIV/AIDS. But people can achieve viral suppression. If they stop to take their medications because they have been virally suppressed, the virus will come back up. The viral load will increase in their body and they can progress to, AIDS. So they shouldn't assume that they are cured. But if they continue to be on the antivirus, first of all, they themselves will not progress to AIDS. They will not become sick. Somebody who has HIV infection in their body is not sick yet, but they can become sick if they allow the virus to grow and overwhelm their immune system. So they are not sick yet. They can live their normal lives. They don't need to be on bed in hospital. There's nothing stopping them from doing anything. They can achieve suppression, but that is not cure. And if you achieve suppression, they cannot transmit the virus to other people. Chances are very minimal of that happening.
All right. And still with you, Dr. Anza, Joel Godwin from North Bank also was curious whether one's blood group can be make the person immune to coming down with HIV and AIDS. Is there anything like that scientifically and medically?
Well, it's not known to science that there's such protection that's based on somebody's blood group. HIV affects people of all blood groups for whatever. So there's no such thing as one's blood group. I know you said something, if your blood is very strong.
Yes.
It's not, there's really no such terminology, blood that is strong or blood that is weak. No, there's no blood groups, gender, age. There's nothing that, that protects against HIV is on that basis. I believe probably we'll talk a bit more about the preventive measures, those who've not talked about maybe before the end of the program, but it has nothing to do with, there's nothing innate, there's nothing in somebody's biological makeup currently that makes them, gives them an edge, by protecting them from acquiring the virus.
All right. Now, Mrs. Toji, Daniel Otena was curious also that why is it that it's only on what is it that condoms are distributed, and maybe to tie it together with Tefado, who is wondering that he has never seen a female condom. Is there any female condom? Tefa wants to know. Maybe you can direct him where he will come to your office and see one physically. But that's my own, not his part of his question. Anyway.
All right. So just to say that condoms are available, and it's just that there's most of these resources, because they are mostly supported by donors. They are not, should I say, unlimited. Probably at that point where they were doing community testing in their location, there was stock out of condoms at that particular time. So it's really not sustainable. So most times when we do community awareness creation sessions, we just give people, when you are talking to people about a particular thing, you also make them see what it looks like.
Yes.
So we just to let people know that you can use this to prevent HIV. You should be able to take ownership of your health by also going an extra mile to buy, so that you can prevent yourself from getting HIV. And yes, there's availability of female condoms, and although because of that aversion, not many people like female condoms because of it's larger, and the woman needs to insert it inside her body. So not many people are really comfortable using female condoms, but yes, there are female condoms, and he can access female condoms from a pharmacy or a healthcare center that is very close to himself, because those are made available at those locations.
I
Yeah,
think
so-
part of his question too was how effective are these condoms in addressing the issue of one contracting HIV and AIDS?
Provide about 98% protection to a person. But of course, there's another snag to the use of condoms. The effectiveness of condom is based on the consistency of use and the correctness of use. Because condoms can only protect you that much if you use it consistently and you also use it correctly, to avoid that condom busting during sexual intercourse, or to avoid condom rolling into the woman's cervix during sexual intercourse and all of that. So yes, if you always, you find out that most people, couples, when they get into a relationship at that initial instance, they might say, oh, I really don't know this person, I'm trying to understand. And then maybe 2-3 months into the relationship, they've not even tested for HIV. And even if they test for HIV, there's window period. What if the person is in the window period and they now throw caution into the wind and begin to go skin to skin without using condom? So the condom will only protect you if you use it that much, if you use it correctly and consistently. Check the expiry date. Avoid using your teeth to open it. There's also a rough edge and that smooth edge. Open it through the rough edge. And then also just use your fingers to check if the condom still has that bouncy feel, to be sure that the oil has not seeped. Because mostly people carry condoms, they put it in their wallets and sit on it. And in sitting, the oil seeps. So those kind of condoms would not be able to protect you, but it provides as much as 98% protection, if given the conditions that I have also spoken about. Yeah.
All right. Barrister, you are an advocate. You have been working with healthcare partners along this line. So, Jonah Benjamin asked us whether mosquito bites can, if a mosquito bites someone who is HIV positive and bites another, can it transmit? In your advocacy and sensitization, is it part of anything like that?
To the best of my knowledge, mosquito bites cannot transmit HIV and AIDS. I mean, if mosquito bites would transmit HIV and AIDS, I mean, all of us in Nigeria will be infected with HIV and AIDS by now. So mosquito bites do not and cannot.
All right. Dr. Anza, I hope that is also correct medically.
That's correct. They cannot transmit the virus.
All right. Now, let's
So
conclude.
what mosquitoes can transmit is Plasmodium that causes malaria.
Malaria.
Yeah.
Simpliciter.
And
Yeah.
even the
So-
mosquitoes that they say transmit malaria is the female Anopheles.
Aha.
I don't know why the doctors decided to say it's only the female one. Maybe, but that's okay.
Maybe a World Malaria Day will come back and
that's the
discuss
subject
about
of its
that,
own.
yeah.
So, Dr. Anza, walk us briefly about the origin of HIV and AIDS. Sunday Akbar is curious. What is actually the origin of this AIDS? And also the perception of some persons who were alleging here that it's God's punishment. Medically, we're not talking about God anyway on the program, but just give us a brief understanding of it.
Well, what we can say from the point of view of science, that's not to dispute that there may be supernatural causes to things. We know that life exists on a number of planes, and that is allowable. Science has made progress from the primitive stage to submit to superior evidence. We cannot say that, we cannot tie, because we don't have these instruments to verify supernatural causes of disease in science. That doesn't mean they may not be. They may be, but within the context of science, we start to track disease from the point where they enter into our verifiable spectrum. There's a spectrum that is visible, is verifiable, the scientific spectrum. The things that are beyond that spectrum are not verifiable by us. So we trace our origins from the point of entry into our, verifiable spectrum. So what is known about HIV is that, there are some theories that claim that it came from, men, people who had sex with, animals like monkeys and so on. But what we know that is that this virus was found among people. There was a kind of respiratory tract infection, a kind of pneumonia that was found among people, a group of people, when this virus was first discovered. And these were people, when these people were studied, this pneumonia was peculiar in its characteristics. And when these people were studied, it was found that they were a group of people who were having, sex, men who were having sex with men. There was also this skin manifestation, what we call Kaposi sarcoma, that was found among them. This was already, opportunistic infections that were happening in this group of persons. Now, these people, when studies were done, this condition was diagnosed as AIDS, acquired immunodeficiency syndrome. Acquired because it was not inborn. It came from somewhere. And then immunosufficiency, because of course it affected the immune system and led to a deficiency. And it was a syndrome because it was a collection of signs and symptoms. Now, it was much later, that the thing that was causing this disease was now identified as HIV. So to say it came from this animal, or to say it came from here or it came from there, is a bit contestable, because there are a number of sources that claim one way or the other. But this is how the history of HIV evolved. So from there, the virus that causes the disease was identified. We talk about two types of HIV, type 1 and type 2, and then we are where we are today. So scientifically, we cannot tie it to any supernatural occurrence, because we don't have adequate scientific tools to investigate such at the moment.
All right. So I hope, Sunday, your question is answered. Let's take a few more calls before we come back. Good morning. Hello. Okay, we lost connection with you. 0814-335-9292. 0814-335-9292. That's the line to call in on the program. Good morning.
Hello, good morning once again.
Thank you for joining us.
It's Tuna back on the line. Someone asked a question. Say, the symptom of HIV, we want to know.
Okay, we'll talk about that, Jonah. Thank you.
All right.
Thank you. Our discussion is not done yet, so even if your question is not answered in the immediate, or when we talk about more issues, you will get to hear. Good morning. Hello. Okay, you barely could come on, so we'll have to disconnect with you. Hello, good morning. Good morning.
This is Zachariah from Berlin, Gois local government.
The name is who?
Sue Zachariah.
Sue Zachariah.
Yes, sir. Local government, Berlin.
Berlin or Balom? I'm not hearing you very well, Sue.
Berlin.
Okay, good. Go ahead, Berlin. Or Berlin.
Yes. Is to advise my listeners or the people listening to you there. Some people have the misconception that this AIDS is done through the village people. They take it as supernatural something. Someone will say that this is caused by my uncle from my mother village or my maternal village. So I want to advise people that this is not supernatural.
All right.
It's scientific something.
Thank you, Sue.
Nice talk.
Sue Umbalin, thank you very much for calling in. That's what the doctor too said. I think you leveraging on that. It's not supernatural, so please take note. Good morning. Hello, good morning. Okay, if your voice is not coming through, apologies, please. We are not able to get you, and the only thing we can do is if you're able to connect us back, that'll be fine. Good morning. Hello.
I'm back online.
The name is who?
Yes. Engineer Sunday Akpa, back online.
Sunday Akpa, we are encouraging a culture that we don't allow people who have called in to call again, so that we can accommodate other opinions too. So
I understand.
Yes,
I'm sorry.
With
yes, hello?
Yes, go ahead.
It's in relation with the question somebody asked before about the blood type. You want to enlighten us. I've read before that there are a group of commercial sex workers in Kenya, and they were never affected by HIV/AIDS. And even scientists were trying to take their blood sample to study. So I want the doctor to interrogate this so that we can hear. Thank you very much.
Anyway, we are staying on our conversation. Let's not go beyond our World AIDS Day. We are not. It's not just the subject matter of what we are not doing research into AIDS in particular. Ours is just a sensitization. So if we go into too many aspects of it, it may be beyond the scope of our immediate discussion. So I'm sorry. 0814-335-9292. 0814-335-9292. Hello, good morning. Hello. Okay. We are gradually getting to a point where we'll stop on the course. Good morning.
Yeah, good morning, sir.
Thank you for joining us.
Kevin Tahoe is my name from Logo Local Government.
Okay, which part of Logo are you reaching us from, Stephen?
I mean in particular, taking the antivirus drugs. Tested.
Yes?
Yes.
Would that be all from you?
I'm sorry. Okay.
All right, Stephen, thank you. It's same consistency about the antiretroviral drugs we talked about. But all the same, we'll give you a refresher just for purpose of information. Good morning.
Good morning, sir.
Thank you for joining us on Perspectives.
This is Lubem Daniel from North Bank.
Okay, go ahead, Lubem.
I want to appreciate the guests in the studio.
Thank you.
And the man who gave us clarification about science and supernatural aspect of illnesses or viruses, I appreciate it.
Yes, go on, Lubem.
Sir?
Go on.
Okay, I want to also make my contribution that it's not naturally right even to discriminate. Talk more of stigmatizing those living with HIV and AIDS. Some have gotten this illness post-viruses from mysterious ways, through sharp objects, some their life partners not opening up to them on time because of them being scared. Well, some have also gotten it through their wayward lifestyle of living life of the world today. But it's all the same. You don't have to blame them. You have to live with them as humans. Most of us are living with other sicknesses that people don't know about, that are even worse than HIV and AIDS. Yet nobody stigmatizes us. So it's always good. It affects, when you stigmatize them, it affects their psychology, their physical well-being, their lifestyle and all of that. They are scared of even being with people because they are scared of people laughing at them. It's not good.
All right.
So
Thank
please.
you. Thank you, Lubem.
You're welcome.
Thanks for calling in. That will be the last call we'll take on the program today. Dr. Anzar, let's look at how this ART has impacted HIV and AIDS treatment.
Okay, thank you very much. I think his question was still on whether this is detected. Yes, we have there's what is called virus suppression. There's what is called being the viral load being stable. It means that the time it will build up to table. It means that the time it will build up to viral medications detectable. The chances of transmission are also very slim, and that's one of the key objectives of percent of persons know their status. 95% of those who are also enrolled into care should chances of transmission are also very.
Some of the effective strategies for preventing the spread of HIV and AIDS.
So there are some strategies that are captured in, previously it used to be the ABC of HIV prevention. And what do I mean by the ABC of HIV prevention? First, you abstain, but abstain from sexual intercourse completely. And abstinence means you are totally not doing sex at all. And then the second option is being faithful to a faithful, uninfected partner, because If you are faithful and your partner is not faithful, the chance is that you are also vulnerable. You are vulnerable if your partner is not faithful. You are also vulnerable if you are faithful and your partner is infected and is not on medication, so to say. So we preach being faithful to a faithful, uninfected partners. Use condoms correctly and consistently. And then disease from sharing needles and sharp objects. And we have also said that for persons who have HIV, discordant couples, so to say, one has HIV and the other does not have HIV, you can actually use pre-exposure prophylaxis to also prevent yourself from getting HIV. That is, if you are constantly having unprotected sexual intercourse with these persons, and then also access PEP, which is post-exposure prophylaxis for mostly persons who are exposed to needle stick injury, or persons who during sexual intercourse there's condom bursts, breakage, or persons who are victims or survivors of sexual violence and all of that. And then for the women, for the vertical transmission, we try as much as possible to ensure that women who are pregnant on time, they access antenatal care, so that they will be able to detect on time if they have HIV, and then go the prevention of mother to child transmission routes to be able to prevent transmission from the mother to the child. So that's it.
Okay. Barrister Boom, what role can education play in preventing the spread of...
Have a whole lot to do, because education is key. The awareness we're doing this morning is part of education. Schools can start talking to children right from the kindergartens about safety measures on how to prevent HIV and AIDS. Schools have enormous work to do in educating children, in educating their students on HIV and AIDS, that this can infect them if they expose themselves to sharp objects. I mean, yes, of course, I know that my little boy comes home and tells me that it's not correct using sharp objects. So I believe that schools are already doing that, and we want to encourage them that they still have much more work to do to educate even the little ones, even right from the kindergartens and even in the universities, to educate them that, for me, I advise abstinence if you can, but if you cannot, you use your condoms, you use your protective measures to ensure that you do not contact HIV and AIDS. So schools have a lot to do, and we encourage that. We still need this sensitization. We still need much more of this education right from the kindergartens. Let these children know that this HIV and AIDS is deadly, and they can save themselves, they can prevent themselves from contacting HIV and AIDS.
Okay, Dr. Anza, how regular should people check their status for HIV and AIDS, and how can the government improve its response to the HIV and AIDS pandemic with regards to access to healthcare for people living with the condition?
Well, when you say how regular, what I would say is maybe it depends also on the risk stratification. Yes, we have talked about the risk factors. For people who are, okay, let's say people who are in the key populations, or people who are engaged in activities that put them on constant risk of having this virus, it will be advisable for them to check their statuses at least every 3 months. If they are inactive, maybe commercial sex workers, and so on. People who are in those kind of, who are constantly engaging in risky behaviors on an ongoing basis. But for the general population, the frequency of checking for HIV status has to depend on the state of their exposure. For instance, this is let's say this is an individual who has been practicing abstinence, who has not shared any sharp objects with anybody in the past 1 year, who has not received transfusion from any source. I mean, maybe yearly, if you say, or maybe 6 monthly, but that will depend largely on the individual's understanding of their exposure to risk. I mean, to the risk of acquiring the disease. It's not a respiratory, it's not an airborne condition. There are places, there are things you would have done that have increased your risk, the chances of acquiring the virus. And then finally, they should check their status anytime they are in doubt. Anytime you are in doubt of your status, it's good for you to check it so that you'll be sure of what it is.
Okay, a few messages before we conclude. This one says, my name is Tetini Moses Kuhe Inachusai. Michael, I want to know the symptoms of HIV and AIDS in children. If a child is affected, how will you know? Okay, Tetini, thank you for your message. Another one here says, good morning, Natania, and your guest in the studio. I will advise that people should be very careful and stop living careless lifestyle like drinking, smoking, and intake of hard drugs, which can lead to unprotected sex, as HIV and AIDS is not written on anybody's forehead, and prevention is always better than cure. Vincent Akko from Wadata. Vincent, thank you. This one says, good morning, I am Vera from North Bank. Can two partners being positive give birth to a child that is negative? Okay, Vera, thank you for your message. We also talked about that, but we'll reflect on that briefly before we conclude. Another one says, and this one, no name to it. This one says, good morning, panelists, and thanks to the guests. Thanks you, Natania. Improving safety standards by human and treatment of disease, the requirement. We should intensify training of pathologists to prevent and cure for HIV/AIDS. Doctors are critical in this area. Isaac Utsua from EA, from Tseanchiha. Let's respond to, can two partners be positive and give birth to a child that is negative? Vera is asking us. Respond to that pointedly.
Yeah,
in your engagement with people in the field, you may have come across this.
Very well. We've spoken to some extent about that, maybe passively, but to a couple that has are both HIV positive can give birth to HIV negative. We have many of those kind of children on our program. And just to say that there's no science has shown that there's no HIV in the ovary. And there's also no HIV in that sperm cell that fuses to fertilize and bring about a baby. So if the HIV positive couple actually goes to the hospital and works with healthcare workers through the process of prevention of mother-to-child transmission, it is very possible, and we have seen a lot of those kind of babies. Yeah.
All right. Now, Dr. Anza, Moses Kuhe wants to know the symptoms of HIV and AIDS in a child. How would you know if a child is affected? Let's respond to that pointedly.
Okay, in children, just like in adults, when it is HIV infection, when it is only the infection, there may be no signs. The person may be asymptomatic. But when it progresses to AIDS, then we start to talk about things like there may be fever, there may be persistent diarrhea, there may be unintended weight loss. There may be all these things are coming from the opportunistic infections. There may be skin manifestations. There may be malnutrition. There may be tuberculosis. There may be pneumonia, and a lot of nearly any kind of infectious disease can infect and then affect somebody who has HIV, who has AIDS. When they have HIV, the immune system is still, able to contend. But when it progresses to AIDS, that's when symptoms come in, and they are not specific. That's one thing. You cannot say this is, if you see this, it must be AIDS. No, they are not specific. These are busybody symptoms, busybody diseases, who are just passing by and discover that there's vacancy and jump in, so they can come from anywhere. But we know when we see tuberculosis, we see pneumonia, we see chronic diarrhea, somebody's been passing water stool for long,
all right.
And so on.
Our time is no longer there, but I will give you, Barrister Ahmed, just 10 seconds of your parting words.
Yes, my parting word, I don't know if you remember the person who was talking about the law to protect people living with HIV and AIDS.
Yes.
There is a law in Nigeria. Several states in the country have domesticated this law. That law is HIV and AIDS Anti-Discrimination Act 2014. This law prohibits discrimination against individuals living with HIV and AIDS. This law ensures that people living with HIV and AIDS have access to equal opportunities in employment, education, healthcare, and other areas. The law also mandates that institutions and employers take steps to eliminate HIV-related discrimination and provide a supportive environment for people living with HIV and AIDS. Additionally, the law promotes affirmative action to ensure that people living with HIV enjoy equal opportunities and are not disadvantaged due to their health status.
All right, so the law the enforcement of the law should be tightened.
Yes.
Mrs. Toji, 5 seconds, your parting words.
My parting words will be, do you know your HIV status?
Check it today.
Check it.
Dr. Anza, from you,
2
seconds.
People living with HIV AIDS are members of our communities. They are family members, they are colleagues at the place of work. They are capable of living a normal life and should be availed every such opportunity and support by everyone.
That's our program today. Dr. Msonte Anza is a doctor in the Department of Epidemiology and Community Health at the Benue State University Teaching Hospital. Dr. Anza, thank you very much for coming on Perspectives.
Thank you.
Mrs. Lucia Toji is a Senior Technical Officer on Key Populations Program, living with the condition, and a Senior State Counsel who is with the Benue State Ministry of Justice and Public Order, Barrister Ahmed Boom. Thank you so much indeed for your time.
Thank you so much.
Dear listener, that's our program today. Join us Wednesday for a fresh edition of Perspectives. Check your status and stay safe. My name is Nathaniel Nongo. Goodbye.